Happy and Healthy, a series to help you learn about available resources.
Today we're going to be getting ourselves updated on the benefits available to seniors, something very important to a lot of the population in Hillsborough County, in the state of Florida, and elsewhere. And we're very fortunate to have with us today Michelle Sear, who is with ARP of Florida, the American Association of Retired Persons. Welcome, Michelle. I'm glad you could be.
Thank you, Louise.
Jack Rosenkrantz, who's a private attorney in practice, who is a specialist in elder care law. Welcome, Jack. Glad you're back. Kay Turano, who is the head of Social Security Administration for Central Florida. Is that the
Public Affairs Specialist.
Public
in
Affairs
Florida, yes,
Specialist for the Social Security Administration. Welcome to you, Kay. I'm glad you could all be here. I know a lot of us don't pay any attention to the benefits available until we turn a little grayer, and we really need to know, or our parents are turning a little bit grayer, or it gets to be a big news item. And some people really don't understand what our benefits are. Could you briefly, and I know there are many, but could you briefly explain some of the benefits available to us as the law exists today in Social Security?
Sure. Social Security, to start with, has two different kinds of benefits we pay. The first type, Social Security, is based on your work, and in order to qualify for Social Security, you have to have worked and paid the Social Security tax. And in a minute I'll go over the benefits that Social Security covers. But the other program that we administer is Supplemental Security Income. SSI, as Supplemental Security Income is known, is not based on your work history, it's based on your income and assets. And it essentially is a federal takeover of the old state welfare programs that was done back in 1974. So for SSI, you don't ever have to have worked and paid into it, but you do have to have low income and assets. For Social Security, on the other hand, that's what was enacted back in 1935, and you do have to have worked and paid into Social Security to qualify for it. We pay three basic type of benefits with Social Security. We pay retirement benefits. To qualify for a retirement check, you have to be 62 or older, and you have to have worked and had 40 Social Security credits or approximately 10 years of work. We then pay disability benefits, and that's for people that have worked again and paid into Social Security. But for disability, there's an additional requirement that you have to have a recent connection to the workforce. And depending on your age, that may be a year and a half of work in the last 3 years, or it might be 5 years of work in the last 10 years. Whichever, you've got to have some sort of recent connection to the workforce in addition to being disabled in order to qualify for benefits. The third type of benefits that we pay is survivor benefits. And to qualify for a survivor benefit, the worker has to have worked and paid into Social Security. The amount of work required on the part of the worker depends on how old the worker was when the worker died. Then we pay, in addition to the retirement benefits, we'll pay benefits to the retired worker and to the spouse of the worker or the children of the worker. The ex-spouse can also qualify for benefits. The rules for an ex-spouse, and notice I'm saying spouse, not wife, because it can be an ex-husband or an ex-wife, is that you have to have been married to the worker for 10 years, from the date the marriage began till divorce, and you have to not be married now if you're going to qualify as an ex-spouse. The worker can be married, and you would still have eligibility. But for you to qualify for benefits, you can't be married. You can have remarried, but you can't be married at present. So if you remarried and then you divorced, you still could go back and qualify for divorced spouse's benefits on your first spouse's record.
Now, I made an assumption that Medicare fell under Social Security.
Medicare, yes, I'm sorry, but it's not a check that we pay. It's an entitlement that Social Security enable some, or we qualify somebody for it. To qualify for Medicare benefits, you have to be 65 or older or disabled and receiving a disability benefit for 2 years, or have end-stage renal disease and be on dialysis, or have had a kidney transplant, or if you get disability benefits based on Lou Gehrig's disease, there's no 2-year qualifying period. You can qualify for Medicare upon your entitlement to a check. Social Security's role in the Medicare program is the equivalent of the insurance agent. We get you the Medicare coverage, we establish the Medicare record, but once you have coverage, Social Security doesn't do anything as far as processing claims. That's under the realm of the Healthcare Financing Administration, or what used to be that, the Center for Medicare and Medicaid Services, CMMS, and they actually do the payment of the claims, and they do the subcontracting out with the insurance companies and so on that processes the Medicare claims.
I'm going to ask you more about how people access these different things that are available to them, how they go ahead and enroll. But I want to get to Michelle. And Michelle, I know there's always, especially when we have a bad economy like we do right now, and we have a political race gearing up, there's all this talk all the time about, are we going to lose some of our Social Security? Do we have enough money to fund it? What is AARP's stand on all of this?
AARP was founded by Dr. Ethel Percy Andrus in the 1940s. She was a retired high school principal, and after finding her friend and fellow retired educator living in a chicken coop, she saw an urgent need to address the issues of health and financial security. So she formed the AARP. Our priorities really have not changed at all. We continue to fight for access to quality, affordable health care and lifetime financial security. Currently, we have just recently launched our Protect Seniors campaign. You may see some of our ads, which are airing nationally, about addressing the issue of strengthening and protecting both Medicare and Social Security, essential safety net programs that today's seniors do rely on. There are talks in Washington, D.C. right now about utilizing these programs and the dollars used to fund these programs to address the nation's deficit. And we do not believe that Social Security monies from the trust fund should be used to pay off the national deficit. It didn't in any way contribute to it, therefore it should not be used. We believe that Medicare and Social Security should not be the only things looked at. In fact, Social Security should be completely taken off the table when talking about raising the debt ceiling and balancing the budget. We believe that arbitrary spending limits or across-the-board cuts, they're going to affect real people. They're going to affect our members. They're going to affect people age 50 plus who rely on these programs. And if these cuts happen, then seniors are going to be faced with increased out-of-pocket costs, limit to access of long-term care, and Social Security checks could shrink.
That's not something I want to hear personally. Jack, you're involved in trying to help the elderly population access its benefits and access care, needed care. Can you talk about how difficult or how they do that?
The biggest challenge most seniors face today is how to pay for long-term care and custodial care, because it's often something they believe will happen to someone else and not affect them. Unfortunately, Medicare does not provide long-term comprehensive care. Because of that, most people are either private paying for care or look to our federal programs such as Medicaid to help pay for long-term care. We help people get eligible for the Medicaid program, but there are big changes afoot with the Medicaid program, and that deals with how the government, the state government, has chosen to privatize it, which, without going whether that's good or bad, the difference will be that the state will contract with private insurance companies to manage the long-term care aspects for those on Medicaid. So in some ways, this could be a phenomenal thing in the sense that it's bringing more resources into the community to provide for care outside of nursing homes. In other ways, it's very disturbing because you want to make sure people get good care, And as some would say, you want to make sure that grannies aren't dumped out of nursing homes in order for the profit line. Now, I don't personally believe that they're going to be able to do that without the strong oversight of CMS, the Centers for Medicaid and Medicare Services. Those centers are really going to be looking after the consumer. But it is real and it is true that as we look to long-term care, much like the other benefits that are being cut, you should anticipate more personal responsibility and more self-reliance than ever before. So it's important to do the planning now while you're still healthy.
While we're all broke. I mean, that's what you're saying, actually. We have a caller. You're on Speak Up.
Hi there. I'm enjoying the show, and I have a question.
Okay.
What about people who are about to go into retirement and are not U.S. citizens but have worked in our country on visas? Will they be able to collect Social Security, and are they eligible for Medicare?
Thank you. Good question.
The answer to both is yes. The requirement for someone that's not a U.S. citizen is that they have to have worked just like anybody else and paid into Social Security, and they have to be lawfully present in the United States. Now, if they're outside the United States, there's a whole other set of rules that apply. But if someone is here, say, as a permanent resident alien, so they came, they have residency in the United States, but they have never become a citizen, they have the same right to Social Security and Medicare as anyone else.
Don't you think people get really confused about that when they start talking about the immigration issue and all of this? They think that people who are accessing benefits who don't really deserve them, and what you're saying is you don't need to be a citizen, and not to confuse the issue of like an illegal immigrant, an illegal resident versus someone who was legal and could actually access
Right,
benefits.
I think there's a lot of confusion on the difference
terms.
between documented aliens and undocumented aliens, and people that have worked and paid into Social Security but never become a citizen, and people that haven't worked and paid into Social Security. I mean, there's
And certainly Americans people who are American who live abroad also can still collect on their benefits.
in most countries, yes.
In most countries, not all?
There's a few countries that Treasury bars payment, and we're not allowed to pay them. For example, a U.S. citizen in Cuba cannot receive Social Security benefits.
Oh, didn't know that. Is that true of some of the countries that we're worried about with terrorism as well?
To be honest with you, I don't remember the list. I know it's
But
a
there's
very
a
short
list.
list. It's a very short list, and it changes. I want to say North Korea might be one, but I could be wrong. I just don't remember the countries. But there are countries where if you're present, we don't pay you, and not only do we not pay you, but it's not like we hold the money and give it to you when you come back. You're just not entitled when you're in that country.
Okay. Jack was talking about Medicaid and perhaps having to go on to Medicaid in order to access long-term care benefits. What are the requirements for going on Medicaid as it is?
I think Jack probably can answer that
Better?
better,
Okay.
absolutely.
Well, generally speaking, when we're talking about Medicaid, you have to be poor. And how we define poor for a single individual is someone who has less than $2,000, and I'm referring to a program that pays for nursing home care. Now, they don't count the house. They don't count your IRAs, as long as they're in payment. And as a single individual, as I said, you can only have $2,000. Otherwise, you'll be private paying. But certain assets, they
And you'll
don't
quickly
count.
be down to $2,000, very quickly, I would imagine.
Average cost of care is about $8,000. Between $6,000 to $8,000 is going to be the cost of care
Per
month.
$6,000 to $8,000?
Per month for a nursing home.
You do better on a cruise ship. I mean,
That's, it's interesting.
am I kidding or what? No.
If you want to have comparison statistics, researchers use the prison population for comparison statistics, because the expense you use for the security is equal to the expense you use for care cost. So it's a fascinating anomaly when you're looking at statistics in care. But when you go back to the underlying issue for Medicaid eligibility, which is your underlying question,
Right.
most people who are looking at these expenses are worried about how they could become eligible, because they saved for a rainy day, but they never thought it would rain like this.
Not to the tune of $6,000 to $8,000 a month. How
But
long can you
again,
go? Even
gotta
if you had
balance-
$100,000 in the bank, that's not very long.
But again, these are programs that are meant for the poor. Now, if you're married it's a little bit different. You can have a little over $109,000 in assets for your community spouse. And there's certain income that you can shift, either some or all of your income, over to your wife in the community or your husband into the community. So there are ways to protect those dollars to maintain the livelihood for your spouse.
So it takes some planning.
Planning is very important. And the most incredible thing that I can say is that understanding the regulations and rules become very important. Because let's assume someone had a duplex they rented. You would think that that was an asset, but in fact it's considered a stream of income, and for that reason it's not counted as an asset. So someone could have a savings account that had $100,000 in it, and a different person could have a duplex that's worth $100,000. As the duplex was rented, they wouldn't count the duplex as an asset. So there are all sorts of wrinkles with the rules, depending on how you do things, that you can have some assets that typically people wouldn't think were possible. The biggest mistake most people do not realize is that their house is not counted as a resource. If their house is less than $500,000 if they're single, they will not have a problem with their home being retained and passing on to family. Other states have lien laws that could apply, but because of state of Florida, homestead, it protects the residents from for sale or lien if it's being passed on to family. So it's
As long as it's below $500,000 in
yes,
value.
and if you look currently in the marketplace, there are much fewer homes that are worth more than $500,000 in our community. They're out there, but those people aren't seeking Medicaid.
As they shouldn't probably need to.
Most people who seek the Medicaid benefit are not the extremely wealthy and not the poor. It's the one that were the working class, hard-working people that have enough for the here and now and have enough to take care of the family, but they have too much to get eligible for the government programs for the poor. In 1988, when they passed MECA to allow married couples to retain the assets so they didn't both have to go broke, at that point, that benefit was opened up to the middle class. And when I talk about middle class, I'm talking about the average worker, not the ones that have millions of dollars stashed away. The people who see the biggest benefit from our services are those people who are having problems making ends meet because they have health care expenses. Trying to do it in a way that preserves dignity, personal choice, and truly medical direction because the patient's in control of it, is the sort of advice and healthcare advocacy we suggest people seek out.
I want to find out what ARP's position is with regard to Medicaid and long-term care as well, and whether you're involved in it. But I think we're going to take a quick break right now, and we'll be back in just a minute. Stay tuned and hear more about the current senior benefits, what's out there.
Patty, I boldly went to socialsecurity.gov, and it's out of this world.
Socialsecurity.gov is a website for everybody.
Even teenagers?
Absolutely. Young people can help their grandparents with retiring online or getting extra help with their Medicare prescription drug costs.
So really, everyone of all ages should go to socialsecurity.gov.
Boldly go.
If Congress really wants to balance the budget,
they could stop spending our money on things like
a cotton institute in Brazil,
poetry at zoos,
treadmills for shrimp.
But instead of cutting waste
or closing tax loopholes,
next month, Congress could make a deal that cuts Medicare,
even Social Security.
I guess it's easier to cut the benefits we earned than to cut pickle technology.
We're back talking about senior benefits with, again, Michelle Sear, who's with ARP, Jack Rosenkrantz, specialist in elder law, and Kay Turano from the Social Security Administration. I was asking before our break what ARP's position is on some of these long-term care issues that Jack was talking about. What are they doing? What's ARP doing about it?
As far as long-term care, Medicare, and Social Security, AARP's priority right now is Social Security and Medicare at the national level. We believe that we need to strengthen and protect these systems not only for today's seniors but for future generations. And as far as long-term care goes, we need to make sure that we also have long-term care, home and community-based care available in the communities. When you ask our members where they would prefer to receive their care, whether it be in an institution, a nursing home, or in the convenience of their own home where they're able to live independently for as long as possible, 9 out of 10 of them are going to say they want to live in their own homes. So we need to have home and community-based services available to them. So AARP is a big supporter of that.
And I'm sure Jack's going to tell me how much cheaper that would be than it would be
Save the state a lot of
incarceration.
money.
But we have a caller. Let me get that right now. You're on Speak Up.
Yes, hello. What a great show. It's very informative. I'm a middle-aged woman, and my parents are both retired, and they're pretty much becoming very elderly. And I know that in the very near future, I'm going to have like a nurse at home to take care of them, or you know, maybe I need to put them in a home. I just know that eventually I'm going to become a caretaker. And I was just wondering, besides Medicare and Social Security that my parents will be receiving, are there other programs out there that can help me with expenses? Because I know it can be quite costly. Thank you so much.
Thank you. So we're right on to point here. And it certainly would be easier for most people if they were at home. What's your answer to that, Jack?
Well, you know, when we talk to somebody, we really need to know a lot of background. And like one of the things I would have asked the caller, and I'm going to assume because it allows me to go on and talk about this benefit, is was her father a veteran? Okay. Now, even though someone may have been a veteran years ago, back in World War II or Korea, and they were completely healthy when they separated from the service, many veterans are not aware that there are public benefits available to them as a veteran to replace the income that they have spent on care for themselves or their wife. So let's assume for a minute that the daughter is caring for her father.
Okay.
If she is and father's living with her, she could charge her father for the care that she's giving, although I know that's what daughters often do, and the father could get reimbursed up to $19.49 a month from the VA for the care that the daughter is giving.
So if she moves him in, that might help her pay her mortgage or the additional bedroom she needed, or
if she has someone who's hired that she's brought in as staffing for that can be good too. And most people are unaware that the veteran could get the benefit if it's their spouse who's ill. Most people are unaware that if the veteran passes away, that the spouse herself could obtain a benefit, a cash benefit, a check in the mail.
Up to that amount of money as well?
Well, the survivor of a veteran will get less. It's $1,056. And there are free people in the community called the Veteran Service Officers of Hillsborough County. If you're in Hillsborough County, you call it the Hillsborough County Veteran Service Officer, right around the corner here, around 113th. And they're able to come out to the home if the veteran is not able to come to them and help sign them up for these programs if they sit eligible. So it's a great service, and it's a wonderful program. And it can
And that's
provide.
totally separate from what Social Security is doing.
Oh, totally different. And that's the question. How does a consumer know? How does an individual know how to layer the VA benefit, how to layer the Social Security benefits, how to layer the Medicare benefit, and the Medicaid benefit that's available? So you're able to get a comprehensive answer. How do you take all these pieces and make a quilt of care? And that really takes time.
You're asking the question now, I want to ask it to you. How do they? They have to how do they know?
The consumer has personal responsibility of becoming informed. That's the biggest change I see in the system, that you cannot rely on someone else or the healthcare system to tell you where you fit in and how you need help. Now, Does that mean the healthcare system won't have information? We have found they have a lot of information, but they tend to give you that information at the time you least can absorb it, at the time of crisis. What we have found is you got to break it down into smaller chunks. You got to deal with the here and now, but you also have to deal with the later. And a lot of times as you go through healthcare, people are only concerned about the here and now. The problem is what you do today can have a big impact on what you do tomorrow.
And there are things like long-term care insurance, only when you find out about it, it's become too expensive.
Well, compared to what?
When you go to look at it, like, you know, you have a parent. I remember when I went to look at it, my parent, my mother needed help, but by that point, she's too old to get that insurance. And then the agent, of course, then wants to sell it to me, and I'm too old to get it at a cheaper rate. It's like, wow, that sounds really expensive, whatever that was at that time. So once you're aging, they're going to make that be very, very high.
I am concerned about long-term care insurance. I think it's a great thing to have, don't get me wrong. But so few of the people I meet made the decision to buy long-term care insurance. The problem is that when they did buy it, sometimes those policies are out of date, or sometimes they couldn't afford to keep the policy and they had to have it lapse. But when you have long-term care insurance, you have an extra pot of money to make it possible for you to live independently and stay in control. I'm a big proponent of long-term care insurance, but the question is, until it becomes financially more painful for children of elders, they're not going to sacrifice the premium payments because there's such limited funds available for their own lives at this point.
I know there's challenges to the Affordable Care Act, but do we see if those challenges are not won by these various states, are seniors being affected, or the Medicare under the terms of that the way they exist right now? Can you answer, Michelle? Or
I can certainly talk about the benefits that Medicare recipients are going to see that have started already. In fact, Medicare beneficiaries, for their wellness exams, their annual wellness exams are absolutely free starting this year. So when they went, they did not have to pay anything out of pocket. Medicare Part D, which is the part of Medicare that pays for prescription drugs, there's a huge gap in coverage known as the donut hole.
Oh, yeah.
And that costs Medicare beneficiaries thousands of dollars out of pocket should they fall into the Medicare Part D donut hole. Those are
Can
usually
you explain
the folks.
donut hole? Because a lot of people don't know what that means.
Yes, absolutely. Once someone pays, they purchase a Medicare Part D plan through a private insurance company, so they're paying a premium, and in return, that insurance company is helping pay a portion of that prescription drug costs up to a certain amount, and please don't quote me on the amount, it's somewhere around $2,500, and that's between what you've paid out of pocket and what your insurance company has paid. Once you reach that amount, you continue to pay that premium, but your insurance company is no longer paying a portion of that. You're now having to pay 100% out of pocket for your prescription drugs until you reach over $4,000 out of pocket. And at that point, they consider that to be catastrophic, and it'll start picking up, and your insurance will then pay 90% of that prescription drug cost. So AARP has advocated for several years to eliminate this donut hole. And the Affordable Care Act does just that. Over a 10-year period, that donut hole is going to continue to shrink. Starting this year, Medicare Part D beneficiaries who fall into the donut hole, they get 50% off of their brand name drugs and 7% off their generic drugs. And each year, for the next 9 years, that percentage is going to increase until finally, come 9 years from now,
you don't have
that
to pay
donut
that
hole will no longer
$2,000 in
exist.
the middle or whatever it is.
Absolutely.
Okay, so that's one of the benefits. I didn't mean to stop you with that, but there are other benefits that you see that are in the wellness exam.
The wellness exam is free.
Are there
the prescription
others?
drug costs continue to go down. There's huge benefits for people who are not Medicare eligible, for those who are 64 and younger. They no longer have to worry about age discrimination or discrimination against them or being priced out of the system due to pre-existing conditions. For instance, we were just talking about her children who were able to continue to stay on her insurance plan even though they're 24 years old. Up till the age of 26, your children can continue to stay on your health insurance plan. So that's a huge benefit, particularly if you're just out of college, you haven't quite started your career yet, you need that extra bit of help.
Okay, how do people decide, because this is always, I think, confusing, whether they should apply for their Social Security at 62 or wait later? How is that decision to be made?
Well, I mean, it's based on usually financial need and if you can afford to wait or if you think it's a good idea to wait. If you take your benefits, the full retirement age right now for an unreduced benefit is 66. If you take it early at 62, you take a 25% cut. On the flip
On
side
what
of the,
you would have
on
gotten
what
if
you
you
would have gotten
waited.
at 66. So if you have $1,000 in Social Security benefits, if you take it at 62, it becomes $750.
Okay.
Flip the coin. If you wait until 70, it increases by 8% a year for every year that you wait. So that $1,000 taken at 70 is $1,320. Now, when do you start it? Well, if you don't have any other money and you've got to have that Social Security check to live at 62, then I don't think there's much choice. You take it at 62. A lot of the financial planners that I do presentations with are encouraging the people that can afford to wait till 70 to wait until 70, simply because if they were to take the money and invest it, they could not come up with an amount equal to the $320 additional.
Is that 8% mandated? Is that what you're saying? It's like it
That's
has...
been in the law for the amount. The 8% has gone up. It hasn't always been 8%, but there's always been an increase in your benefit for delaying your retirement past full retirement age.
I had no idea of this until the other day. I was flipping the channels and was on WEDU. I was on the PBS station, and Susie Orman said the same thing you just said, which is, she said to this audience of people, where are you putting your money? And if it's in CDs and you're getting 1%, leave the money in Social Security until you're 70. And you do have to take it out at 70, though, right?
You don't have to, but there's no additional money. We don't pay you a higher check for waiting past 70.
Okay, so 70 is the magic number. Now that number, the number now that you just mentioned, 66, is now the
full retirement age.
Full retirement age. That means that they can still keep a job, correct? And
once you reach full retirement age, you can earn anything you want in wages or self-employment, and it won't affect your Social Security benefit.
But if you're under that, then you have to give money back, correct?
If you're under full retirement age, then the limit that you're allowed to make in wages or self-employment is $14,160. If you earn over that, then Social Security benefits are reduced by $1 for every 2 you exceed the $14,160.
So if you were making $40,000, that would be, did I get
Make yourself an easy number. If you're making $44,160,
yeah,
you'd be over the limit by $30,000. Half of that is $15,000, and that's what Social Security would have to withhold from your Social Security benefits before we could start paying you. Now, does it really make sense to do that? Maybe not.
One of the things that people don't realize is if they're married and the husband was the high income earner, it's better for the surviving spouse to have a higher monthly income. So if you have a large age discrepancy in the marriage where the husband is much older than the wife,
which happens quite often,
you could see a financial benefit to delay that Social Security payment.
Right, because if he's getting $1,320 when he dies and she is a widow, she gets the benefit of those delayed retirement credits.
She gets the benefit, but couldn't she collect on on his benefits before he does? Because, or does that not apply?
The comment, the original question was whether or not when you take your Social Security payment, are you going to delay that payment or not?
Right, that's the original, right.
So if we're looking at it, one of the reasons you may choose to delay, if there was a 7 or 8 year difference in age between the husband and wife, and you start to look at life expectancy as a female versus life expectancy of male,
right,
you might make the decision based on, I may not live as long as I would have hoped, but my wife is certainly going to outlive me by this number of years.
So let's make it available to her.
So by making that decision, if I have income coming in, I can defer that payment, because it's going to end up, if I take it now and God forbid I pass, my wife will take whatever that payment is, assuming hers is lower.
Right, now let me give you another scenario that's becoming more common. If let's say that my husband is 60, let's say we're both 66, okay? His benefit at full retirement age would be $2,000, and let's say that mine is $1,000. And let's say we're both working, okay? He doesn't file for benefits on his own record because he's still working and he wants to get those delayed retirement credits.
Right.
I, on the other hand, I say, well, it doesn't matter if I get the delayed retirement credits or not. I'm going to file and I'm going to get my $1,000 a month starting at age 66. The rule says that my husband could qualify for benefits on my record as a husband. As long as he's filing at full retirement age, he can file for husband's benefits only. So he could receive, I could receive the $1,000 on my benefit record. He could receive $500 as a husband and hold off filing for his benefit until he reaches 70. And then at that point, he would get the delayed retirement credits. He'd get, what, $2,680 a month.
So
He'd lose the
collecting under his wife's benefits doesn't penalize him in any way, is what you're saying. Penalize or reduce his benefits that he was due in the
Exactly. But the key to that is you can't file for benefits on your spouse's record and not file on your own record until you hit full retirement age. So you couldn't do that at 62. You have to wait until full retirement age to do that. But that's very common now, especially with women having worked more and more. It's very possible that the woman could file for her own Social Security. The husband continues to work till, past age 66. He could then file on her record as a husband and get a smaller check, but nonetheless get some money coming in. And then when he turns 70, file for benefits on his own record.
See how hard it is for us to understand all this. I know we're going to take a quick break, and we'll be back in just a minute. Please stay tuned. Hear more about senior benefits available to you.
George, it's a great deal. Only used a couple of times, and it gets great parsecs for very little dilithium crystals.
Well, I appreciate the offer, but what I really need is information about Social Security. How do I find out what my monthly payment will be?
Online.
How about if I just want Medicare?
Online.
Oh my. We'll boldly go to socialsecurity.gov.
Let's go kick the tires.
If Congress really wants to balance the budget,
They could stop spending our money on things like
A cotton institute in Brazil.
Poetry at zoos,
treadmills for shrimp.
but instead of cutting waste,
or closing tax loopholes.
Next month, Congress could make a deal that cuts Medicare.
Even Social Security.
I guess it's easier to cut the benefits we earned than to cut pickle technology.
Patty, let me be honest with you. Won't filing for Social Security benefits online be confusing?
George, it's simple and easy, and you can do it in your pajamas from the comfort of your own home.
Oh my.
You've navigated through asteroid belts, right?
Oh sure, plenty of times.
Well, compared to that, navigating socialsecurity.gov is a snap.
Really?
It's so easy. Even Kirk could do it.
We're back on Speak Up Presents, talking to you about senior benefits that are available right now and our concerns about the future. And with us are Michelle Sear from ARP, Jack Rosenkrantz, who's a attorney in private practice dealing with elder law, and Kay Tarano from the Social Security Administration here in Hillsborough County in Central Florida. Kay, you were just giving us some ideas about different ways to get benefits under spouses and so forth. How hard is it to do all this? Do we have to make appointments and take buses somewhere, or can we get this done on the phone?
You can get it done online, which is even faster and even easier. You can file for retirement benefits online. You can file for spouses benefits online. For people that are already getting checks, you can change your address, get a new Medicare card, sign up for direct deposit. You can do almost everything online with Social Security. And the advantage of doing that is the business hours are a lot more wide open. You know,
you can do it at 2 o'clock in the morning if you happen to be up.
Exactly, online. But if you want to go into the office, most of the offices are open. In Hillsborough County, they're open from 9 to 4. And if you call us on the phone lines are open from 7 in the morning till 7 in the afternoon. I would not go into an office without an appointment. So if you choose not to do it online, I would certainly go to the telephone next and get an appointment. We can either do an application on the telephone or we can do an application in the office. But my order ranking of how to contact Social Security is number 1, give it a shot online. If that doesn't work, call us on the telephone. And if that doesn't work, the telephone people can schedule you an appointment.
Okay, that makes life a lot easier.
Online is absolutely the easiest way. I can't go in and play with that to see how easy it is, to see how it works. But I've talked to people that have filed applications online, and they tell me it takes 10 or 15 minutes and they're done.
Very good.
Much faster than even driving to the office.
Very good. Now, we're still, Jack, I keep hearing during all these election things that there's things to be worried about because people want to, I don't know what's true anymore. Is the system broke, or is it not broke, but the federal government's borrowed from it and blah, blah, blah? I really don't know. What do we all need to do to protect these benefits if we want to continue to have them in this country, to care about the elderly or the poor or whatever? What do we need to be doing?
Well, the first thing we need to do is become informed. Most of the population, most of the people who are out there in need of these services are not informed as to what's available. The other thing that needs to happen is their caregivers must get better informed, because there's going to be more responsibility towards the cost of care, and there's going to be more responsibility in making the right choice for yourself. And so as you look at these issues, it's important to get involved, not only in your particular issue, but involved in the bigger picture, because you have to get part of the discussion. You have to join the discussion, because if you can't join the discussion, you're not part of the discussion, then it's going to be a one-sided for those who have financial interest in the outcome. But as consumers, we all have a financial interest in the outcome. So it's important for us to truly become much more involved, much more active, and much more verbal about what we think needs to happen and how it needs to occur. Organizations like AARP is phenomenal in how they've organized volunteers to move forward. And the other thing that I find absolutely amazing is their foundation that keeps everyone so knowledgeable about the choices that are out there and what they mean to us. So thank you to AARP. We have a lot of resources at our disposal.
Michelle, you want to add to what we can do with
Yeah,
support of
absolutely.
ARP or what it's doing?
In order to address the issues that Medicare, Medicaid, and Social Security are facing today or in the future, we need everyone at the table. We need business leaders, community leaders, elected officials, both Democrats and Republicans, and we need the American people, the general public at the table to discuss what options are out there, what are the pros, what are the cons, how is this going to affect real people, how is it going to affect seniors, how is it going to affect future generations, and we need to have these discussions sooner rather than later. For instance, Social Security, yes, we can pay 100% of benefits for the next 25 years, but what happens after that? What happens to my Social Security? According to budget reports, Social Security will be able to pay out 75% of benefits after 25 years.
What you were just saying is it is totally funded for the next 25 years, were you not?
Yes. Beneficiaries will get, if no changes are made right now, 100% of their guaranteed benefits.
Okay.
And that's if no
It's
changes
already
are
funded.
made.
It's not broke.
Right.
It's got the
not
money in
broken.
there. It's in the bank.
It's not. But 25 years from now, or 35, 40, when it comes time for me to retire, 75% of my guaranteed benefits isn't good enough. And we think that if we make small changes now rather than later, we can address the solvency issue with Social Security. And there are ways that people can be part of this discussion. It's really about getting out into the community, talking with the people, and making your voice heard. Your elected officials, you hired them. You elected them into office as a constituent. It's your job to call on them. There are several ways that you can get in contact with your member of Congress. You can schedule visits. I happen to know that members of Congress will be on recess. They will not be in Washington, D.C. during July recess, the first week of July recess. They'll actually be here in their district offices. So I encourage you, make appointments, go visit them, go to their town hall meetings, give them a call. In fact, you can reach them toll-free by calling 1-888-722-8514. Again, this is a toll-free number, and it will automatically connect you with your U.S. Senator or U.S. House Representative, and that number again is 1-888-722-8514. 8514. And to learn more about what AARP is doing nationally to protect and strengthen Medicare and Social Security, you can visit us on our website at www.aarp.org/Protect Seniors. Again, that's our latest campaign, Protect Seniors. You can also find out what we're doing right here in the state of Florida and here in the Tampa Bay area by visiting our AARP Florida Facebook page, our AARP Florida website, or even follow us on Twitter.
I just always am wondering how this becomes such a big political football issue or whatever, as I do with education as well. I don't understand our country or people not being as concerned with their elderly. The fact is everybody's going to get there, unless, of course, they die early. So how does this happen? Does anybody have any idea why this even is an issue, that we wouldn't continue? And since we pay for it ourselves, I mean, we're putting the money in there just like any other sort of insurance policy, why it becomes an issue of, okay, stop this, we don't want it anymore, take care of yourself, or those kinds of things. Anybody want to go for that, Jack? You want to? Or
well,
Michelle?
You got to look historically how these programs were established. Keep in mind that Truman said, without health security, there's no financial security. And if you look at what President Truman tried to do, it can really go back to those days of Truman. And it explains why we have our problem today. Because at the time, AMA came out against the ability to have government-sponsored health care. But they wanted the bonds to help build their hospitals, the infrastructure for them to work.
Okay.
So we had a split system. But if you took the federal government's money to build that hospital, you had to take the poor in for care.
Okay.
So when you took the federal dollars, at first the indigent care wasn't that expensive. There wasn't a problem. But those people who sent their children off to World War II are the same people who suffered through the Depression and got wiped out. So as the 50s and 60s rolled on, the financial exposures to these charity hospitals got so heavy that they were at risk, perhaps, of not being able to continue on. And these were bonds that were issued by the federal government. So if they defaulted on the bonds, there would be an issue. In my studies, and I'm not sure I'm accurate on this, it would appear that one of the reasons that we moved forward with Medicare and Medicaid was to make sure we had funding for those hospitals so they didn't default on their bonds. So what happened? What happened is in the 65, they reached back to Truman's old health care plan, blew the dust off it, spiffed it up, and went out to the Truman Presidential Library to sign into law Medicare and Medicaid. The first person to get a Medicare card was President Truman.
Wow.
I bet Bess was the second, but I don't know that. My point, though, is we're looking at a system that has its historical roots at the end of World War II, because that's where the infrastructure of what we tried to do was passed in the 60s. It's time to have a different discussion about health care and a different funding source. So it's really unfair to look at the system and the infrastructure we have now and expect it to handle modern health care in the same way it did, because our modern health care is radically different from 1950. And because of that, we have different specialties, different expenses, and it needs a different infrastructure to pay for it. And how you take care of yourself today has a direct impact on what long-term care you'll need tomorrow.
That's a good point.
So it's going to take a lot more personal involvement, and there's going to be a decision in the community as to what we will pay for and what we won't. And if you are in self-neglect and you cause this issue for yourself, are we going to be supportive as a community? I suggest to you we're in the process of writing a new social contract for care. And it's through organizations such as AARP and others, and the government too, they're having open meetings as well, that this new social contract is going to get written, and whether you like it or not, it's being written. So if you don't like what you hear, get involved.
Kay, can you tell us anything about what your opinion is on this? Not really?
No, I really,
You're there administering it
that's it.
and not getting involved so much in how they decided. What about you, Michelle? Can you tell us
How
comment
they're
on what Jack is saying here about there needing to be a new social contract?
I know very little about any social contract. I believe wholeheartedly that you have to be accountable for yourself. Your wellness exams, your individual maintenance, making sure that advanced directives, living wills, that all of these are addressed. And we believe that whether you're doing it for yourself or you're a caregiver for a loved one, that planning for tomorrow is essential.
Any other advice you want to make sure that our viewers are aware of with regard to your organizations or what you're doing?
Save for your future. Social Security was never, ever supposed to be your entire source of income. And the people that have it as their entire source of income don't live very well. And I've worked for Social Security for 35 years, and for 35 years I've heard people say, you just can't live on what Social Security pays. And the sad
they were
answer
like
to that...
expecting it, like we were expecting it to
But
happen.
the sad answer is you were never supposed to be able to live on what Social Security pays. And I read something not very long ago that said that most people couldn't put their hands on $2,000 within 30 days if they had to.
Really?
40% of the population. And that's terrifying when you think about that in the terms of retirement. Where are they going to be, and where would they be if they didn't have Social Security when retirement comes?
Do you see in Social Security's statistics that people are waiting to retire a lot later as well? Or is that any statistics that you keep?
I haven't. I mean, I'm sure the government has statistics on everything. That's one thing that the government does quite well, is keep numbers. I think that what we've actually seen is because of the economy and unemployment, people that may have worked until later in life and delayed their retirement became unemployed for whatever reason, and they file for Social Security early. So typically when unemployment goes up, Social Security filings raise also, and people are filing for their retirement benefits early as opposed to waiting because they need the money.
Right. Okay. Jack, some other things you feel that our viewers should be made more aware of, besides that they have to take care of themselves and learn more about what's out there?
The worst time to learn is when you're in crisis. The best thing to do is, if you know you have an issue, move forward and address it, and try to get as much information through support groups, through educational talks, through the community. You can always contact your area agency on aging, and the different referral centers that are out there for information and referral. The challenge is it's not that you're going to get no information. The challenge is you're going to get so much information, and it's hard to figure out how it applies to you. Professionals, such as an elder law attorney, might be able to be helpful, but so might a geriatric care manager or the SHINE program that the state runs without any cost to the consumer.
SHINE?
SHINE is a program where they give advice as to insurance and coverage and what things you might want to get. It's a wonderful program that's out there. So my last 2 minutes of advice would be informed, be prepared, and be proactive, absolutely.
I almost want to ask you if you would teach a class where every week we just learn a little piece of this. All of you would get together and do this so we could go and learn what we need to learn, even though we really don't want to. We don't think we're going to need it, but you're so right. We're going to need it. We're going to need it for our parents, or we're going to need it for ourselves at some point, so we better get involved in this. And Michelle, what would you like to add to this too?
I just want to reiterate what Jack said, is be involved. You know, we understand Social Security was never meant to be our sole source of income at retirement, but with today's economy, that is the sad truth, that many Americans, thousands of Floridians, do rely on Social Security as their sole source of income, and if their benefits were to be cut, it would be drastic. And so we need everyone to be part of this conversation. We need everyone to understand what solvency options are out there, what the different proposals regarding the national deficit, addressing the national deficit, what those proposals could mean to them, so that when they contact their member of Congress, they can speak on their own behalf and talk about what cuts to Medicare and Social Security could do to them and to their loved ones.
I don't think any of us expected what's happened in the last couple of years, so we thought we had houses we could sell that were worth a lot of money if we needed it, but now they're not. They're worth so far less. We had maybe mutual funds or some other kind of investment thing, even CDs that were paying 5 or 6% a year a few years ago are now down the toilet. So there's no question that we're going to have to rely on some of these other supplemental things, as you point out. They weren't meant to be the whole thing, but even if we made all these plans, you know, and invested in things, those things went down the toilet. And so now we're going to have to know better, and the generation of today, I mean, young people today they're witnessing this, so they really need to know. I so appreciate all of you coming and talking about this issue again and again. I wish you would all teach classes, because I think everybody would love to know everything that you know and pick your brain. I'm sure you'll get phone calls about this. Thanks all for tuning in.
At socialsecurity.gov, you can apply for retirement, disability, or Medicare from your own home.
Chekhov applied in his pajamas.